you've had to go seek that information out, right?
Yeah,
Did you have?
I've been asked to present in a couple of different situations, education to physicians. It's definitely something, but you kind of have all edges of the spectrum because there are a lot of doctors out there that are convinced, that the main hesitancy that I get from doctors is that they're not able to control the dose that a patient uses. And so they're very concerned. And in my opinion, as a pharmacist, I don't see that as a negative. I see that as a positive for patients because they are able to take more control over how they feel and what they use. And doctors are just so used to controlling, writing a drug dose frequency, writing all that out on a prescription, that they're not comfortable with the fact that the patient can, essentially dose and manage themselves.
Manage their own treatment.
Oh, right. Right. And then there are also doctors, like I've gotten into arguments with doctors over the fact that they think like, no, well, it seems like the research shows that like a 3-to-1 THC to or CBD to THC is the most appropriate dose. I'm like, no, everybody's different. Everybody has
the person who wrote that article.
Yeah, everybody has different needs. Everybody has different benefits from different, different things. I do think that in the future, we all talk a lot about what we think is going to happen with this. I do think that there are going to be pharmaceutical grade, combinations of these medications that are going to be dispensed in regular pharmacies.
I would like to see it all be like dialed into exactly what the patient needs.
Right.
To an individualized basis.
Right.
Like pharmacies should be equipped with what they need to make the combinations.
Right. What I do want to see though is not a stripped down just ratio of cannabinoids. I want to see, a whole plant product that has all of the other things in it so that you get all of that entourage effect.
Right. Yeah.
Entourage effect.
Yeah. Right. Yeah.
So.
Yeah.
I think that all is going to play into patient education, though. I think that those things are all there already. Like we've seen, like the certificate of analysis of a lot of these flowers and stuff that are out. Like they are tested. That those cannabinoids are in there. Like that stuff's there. They just don't that's not on the wrapper. That's not on the display or whatever. I would like to see more of them. I think that the focus is too high on THC and CBD right now, but I think that's just because that's what people know.
Yeah.
I'm saying from about the doctors not having the control. Yeah. From a patient perspective, that is literally the reason, besides obviously enjoying it, but that is literally the reason that I made the switch to using cannabis as medicine from the traditional treatment plan, because they gave me a 30-day supply of these narcotics that were supposed to last me all 30 days. And that I would take one in the morning because I would wake up in all this pain from sleeping all night. And I would wake up, take this pill, and be useless the rest of the day because of this heavy dose that I just took. And by the end of the day, which I'm not supposed to take another one until the next morning, like the balance isn't there. Whereas with cannabis, I can pack one pipe in the morning, get through that painful stretch, but still be able to function. And and just microdose throughout my day versus one pill that's supposed to last all day, but knocks me out and makes me feel like a zombie.
Right. Yeah, I'm totally with the consistent flow throughout the day.
Yeah,